Did you know that heart attacks are a leading cause of death for both men and women? It's a sobering reality that affects millions of lives every year. It's a scary thought, but knowledge is power. By educating ourselves, we can take control of our heart health and make informed decisions. By understanding the risks and taking proactive steps, we can protect our heart health. Simple lifestyle changes like regular exercise and a balanced diet can make a significant difference. One of the most important factors is the health of our arteries, those vital pathways that carry oxygen-rich blood throughout our bodies. Healthy arteries are essential for maintaining overall cardiovascular health. Over time, a dangerous buildup can occur inside our arteries, restricting blood flow and increasing the risk of serious health problems like heart attacks and strokes. This buildup is often caused by factors such as poor diet, lack of exercise, and smoking. This buildup, known as arterial plaque, is a silent threat, often developing without any noticeable symptoms. It can go undetected for years, quietly increasing the risk of a sudden heart attack or stroke. That's why it's crucial to understand what arterial plaque is, how it affects our bodies, and most importantly, how to detect it early. Regular checkups and non-invasive tests can help identify plaque buildup before it becomes a serious problem. We often hear about cholesterol and its impact on our heart health. While it's true that high cholesterol can contribute to heart problems, it's not the whole story. The real culprit, the one we need to be most concerned about, is arterial plaque. Think of your arteries as a network of pipes. Cholesterol is like a sticky substance that can accumulate on the inner walls of these pipes. Over time, this accumulation can harden and form plaque, a thick, waxy substance that narrows the arteries and restricts blood flow. This is like a buildup of gunk in your pipes, making it harder for water to flow through. Arterial plaque is made up of various substances, including cholesterol, fat, calcium, and cellular waste. As plaque builds up, it hardens and narrows the arteries, making it difficult for blood to flow through. This can lead to a range of serious health problems. When plaque restricts blood flow to the heart, it can cause chest pain, angina, shortness of breath, and even a heart attack. If plaque blocks an artery supplying blood to the brain, it can cause a stroke. The buildup of plaque is a gradual process, often occurring over many years without any noticeable symptoms. That's why early detection is so crucial. The good news is that there's a simple, non-invasive test that can help detect arterial plaque and assess your risk of heart disease. It's called the Ankle Brachial Index, ABI, and it measures the blood pressure in your ankles compared to the blood pressure in your arms. The ABI is a powerful tool because it can reveal blockages in the arteries of your legs, which are often early warning signs of blockages in other parts of your body, including your heart. A low ABI indicates that blood flow in your legs is reduced, suggesting the presence of arterial plaque. This test is quick, painless, and can be done right in your doctor's office. Section 5. Your at-home artery check, a step-by-step guide to the ABI test. You might be surprised to learn that you can even perform a basic ABI test in the comfort of your own home using a standard blood pressure monitor. This simple test can help you keep track of your arterial health without needing to visit a clinic. While it's always best to consult with your doctor for a comprehensive evaluation, this at-home check can provide valuable insights into your arterial health. It can serve as an early warning system, alerting you to potential issues before they become serious. Here's a step-by-step guide to performing the ABI test at home. 1. Gather your supplies. Make sure you have everything you need within reach to avoid interruptions during the test. You'll need a standard blood pressure monitor and a notepad to record your measurements. Having a pen handy will also be useful for jotting down your readings accurately. 2. Find a comfortable position. This is crucial for getting accurate readings. Make sure you are relaxed and at ease. Sit or lie down with your legs uncrossed and your feet flat on the floor. This helps ensure that blood flow is not restricted during the measurement. 3. Measure your ankle blood pressure. This step is essential for calculating your ABI. Wrap the blood pressure cuff snugly around your ankle, just above your ankle bone. Make sure it's not too tight or too loose. Place the stethoscope over the artery on the top of your foot. This will help you hear the blood flow clearly. Inflate the cuff and slowly release the air, listening for the first thumping sound, which indicates your systolic blood pressure. Take note of this reading. 4. Measure your arm blood pressure. This will serve as a comparison to your ankle reading. Repeat the same process on your upper arm, using the artery inside your elbow. Make sure to record this reading as well. 5. Calculate your ABI. Divide the higher of your 2 ankle systolic blood pressure readings by the higher of your 2 arm systolic blood pressure readings. This ratio will give you your ABI, which can help you understand your arterial health better. Section 6. Taking your ABI, important precautions and considerations. While the at-home ABI test is generally safe and easy to perform, there are a few precautions to keep in mind. First, consult with your doctor. It's always a good idea to talk to your doctor before performing any at-home medical tests, especially if you have any underlying health conditions. Second, accuracy is key. Make sure you're using a reliable blood pressure monitor and that you're following the instructions carefully to ensure accurate readings. Third, individual variations. Keep in mind that ABI results can vary depending on factors like age, gender, and overall health. If you have any concerns about your ABI results, don't hesitate to reach out to your healthcare provider for further evaluation and guidance. Section 7. Deciphering your ABI score. What do the numbers mean? Now that you've taken your ABI, you're probably wondering what the numbers mean. Don't worry, it's not as complicated as it might seem. Normal. An ABI of 1.0 to 1.4 is considered normal, indicating healthy blood flow in your legs. Borderline. An ABI of 0.91 to 0.99 is considered borderline and warrants further evaluation by your doctor. Abnormal. An ABI of 0.9 or lower is considered abnormal and suggests the presence of peripheral artery disease or PAD, a condition in which plaque buildup narrows the arteries in the legs. Section 8. Beyond the numbers, understanding your ABI results. Remember, your ABI score is just one piece of the puzzle. It's essential to consider your overall health, family history, and lifestyle factors when assessing your risk of heart disease. If your ABI is in the normal range, that's fantastic, but it doesn't mean you can let your guard down. Continue to make heart-healthy choices, such as eating a balanced diet, exercising regularly, and managing stress. Section 9. Why compare? Arm versus leg blood pressure and your health. You might be wondering why we compare the blood pressure in your arms and legs. Well, it's all about understanding how blood flows through your body. Ideally, your blood pressure should be similar in both your arms and legs. However, if there's a significant difference, it could be a sign of PAD. This is because plaque buildup in the arteries of your legs can restrict blood flow, leading to lower blood pressure in your legs compared to your arms. Section 10. Unmasking a hidden danger peripheral artery disease, PAD. PAD is a common but often underdiagnosed condition that affects millions of people worldwide. It occurs when plaque builds up in the arteries that supply blood to your limbs, most commonly the legs. Many people with PAD don't experience any symptoms, while others may have leg pain, numbness, or cramping, especially during physical activity. PAD is a serious condition that can increase your risk of heart attack, stroke, and even amputation. Section 11. Taking charge of your heart. Health actionable steps for a healthier you. Your heart is the engine that keeps your body running, and taking care of it should be a top priority. No matter what your ABI results are, there are always steps you can take to improve your heart health and reduce your risk of developing heart problems. It's never too late to start making positive changes. Here are some actionable steps you can take to ensure your heart stays healthy and strong. Quit smoking. Smoking is one of the worst things you can do for your heart health. The chemicals in cigarettes damage your heart and blood vessels, leading to the narrowing of the arteries. Quitting smoking is the single most important step you can take to improve your cardiovascular health. It can significantly lower your risk of heart disease and improve your overall well-being. Eat a heart-healthy diet. Focus on eating plenty of fruits, vegetables, whole grains, and lean protein. These foods provide essential nutrients that support heart health. Limit your intake of saturated and trans fats, cholesterol, sodium, and added sugars. These can contribute to the buildup of plaque in your arteries, increasing your risk of heart disease. Exercise regularly. Aim for at least 30 minutes of moderate intensity exercise most days of the week. Physical activity helps to strengthen your heart and improve circulation. Manage your stress. Find healthy ways to manage stress, such as yoga, meditation, or spending time in nature. Chronic stress can negatively impact your heart health, so it's important to find ways to relax and unwind. Work with your doctor. If you have any underlying health conditions, such as high blood pressure, high cholesterol, or diabetes, work with your doctor to manage these conditions effectively. Regular checkups and following your doctor's advice can make a big difference. Remember, knowledge is power. By understanding the risks and taking proactive steps, you can protect your heart health and live a longer, healthier life. Small changes can lead to significant improvements over time, so start today and take charge of your heart health.